क्या था?
गर्दन में दर्द था बहुत, हाथ में सूजन।
अच्छा, तो अच्छा, हाथ में दर्द होता था
हाँ,
कुछ?
बहुत ज्यादा।
ओके।
गर्दन में,
कौन
पेट
सा हाथ
में।
में ज़्यादा? ये हाथ।
After taking consent and all preparations, keeping the patient in supine with head extended, after pain draped, before giving local anesthesia, let's discuss little about applied anatomy. You should have a thorough knowledge about the different important structures at different levels of cervical vertebrae and disc to avoid major complications. Needle entry should be always in the midline to avoid the injury of the major structures like nerves, vessels, and muscles. To enter into the cervical disc anteriorly, we have to push the trachea, esophagus, and thyroid gland to one side. The beauty of the anatomy is that pretracheal fascia is enclosing all the structures into its covering. Once we push the trachea, all the structures move together. We can see here now the middle finger is pushing the trachea medially, and simultaneously all other structures of pretracheal fascia are moving together. And by the index finger, carotid sheath is pushed laterally. The space in between the fingers is created to enter into the cervical disc anteriorly. We can see the needle trajectory. Let's start PLDD C56. Local anesthesia is given superficially at the midline. After giving local anesthesia, it's the time to prepare the needle laser fiber set. 10 cm 18 gauge spinal needle is connected with the Y connector. Now the laser fiber is inserted into the needle, and we have to see the firing portion of the laser fiber should not come out more than 3 to 4 mm ahead to the needle tip. After keeping it in the proper position, the laser fiber is locked with the Y connector. We can see here 3 to 4 mm the firing portion of the laser fiber is ahead to the needle tip. Now we will detach the needle and we'll start the procedure. You should keep it in your mind that needle tip should be in the nucleus only to evaporate the nucleus material to reduce the intradiscal pressure. In lateral view, the needle should be in parallel to the end plates and needle tip should not be close to the end plates to avoid the end plate injury.
अच्छा, एक बार शूट कर रहे।
शूट सर।
हाँ, ठीक। शूट करो।
शूट।
We can see how the trachea is pushed to the other side. You can see the white shadow shown by the red arrows. Another important point, you should use the radioprotective gloves because the procedure is done under continuous fluoroscopy.
शूट करो। ओके, ठीक है। आउट करो।
Now we will see in the lateral view, we can see how the needle is slowly entered into the disc. In the same way, the C45 level also done.
शूट। चलो शूट। 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 ओके फाइन, एक बार शूट। हाँ सेव।
Again, you see in the lateral view and see how the needle is slowly entering parallel to the end plates up to the middle of the disc. Now it's time for the laser therapy. We're putting the laser fibers already predetermined. We're putting the laser fibers into the needle. And with proper setting, laser firing will be started. With the foot paddle, you can control the laser firing. You can see the bubbles, how the disc material is getting evaporated. After doing the procedure, it is done in the other level. And the needles are taken out, given proper pressure, ice pack.
ओके अभी आप हो गया कितना दिन देखे?
सैटरडे को किया था।
सैटरडे
अभी
को
10
डेज हो गया आपको। आपको लगता है कुछ फर्क है?
बहुत ज्यादा
बहुत ज्यादा फर्क है।
हाँ।
ओके, हाथ उठाने को तकलीफ, कि हाथ का दर्द?
कुछ भी नहीं,